everyone. Thank you for joining us. We've done this conversation in partnership with Project Sleep. They are a nonprofit organization dedicated to raising awareness about sleep health, sleep equity, and sleep disorders. I also want to acknowledge today the supporter for this webinar, Jazz Pharmaceuticals. So thank you so much to them. I want to get right into our conversation, and I'm going to start by introducing our speakers today. And first, we have Marie Morse. She is a pediatric neurologist, and she's an expert in sleep disorders, and she works at Geisinger Medical Center in Danville, Pennsylvania. So thank you for being here today, Anne. We also have Dr. Lisa Maher. She is a nurse practitioner at the Cedar Valley Cardiovascular Center in Waterloo, Iowa. She has a doctorate in nursing. She established the Cedar Valley Cardiovascular Sleep Clinic over 10 years ago, and she's on the board of directors at the Preventive Cardiovascular Nurses Association, or PCNA, which is a great longstanding partner organization with Women Heart. And we also have with us today a Women Heart champion who is joining us from Lebanon, Tennessee. She attended our Science and Leadership Symposium in 2020 and became a champion that year. So thank you all for being with us. So I'm going to start with Anne, our sleep expert here today, because as I mentioned, our audience is used to learning and hearing all about heart disease. But there's probably a lot of us who are unaware until now about the prevalence of sleep disorders, how to identify a sleep disorder. So I wonder if you can start by just telling us, talk a little bit about what are a few common sleep disorders. I think we hear names thrown around, but if you could just highlight kind of what are some common sleep disorders, what are their symptoms, and if there's any particular difference in the impact they have on men versus women.
Sure. Thank you so much. First, I want to say thank you for having me here. And I also just want to make some clarity that many times people get confused about my title as a pediatric neurologist and go, how do you know anything about adults? And so my clinical practice and my research does extend into the adult world. So with that stated, this is such a timely and important topic. And when we're talking about sleep disorders in the United States, we know that they're incredibly prevalent. You already stated that about 50 to 70 million individuals. In fact, the CDC in 2014 stated that sleep disorders in the United States is a major public health crisis because of the epidemic proportions. Now, when we're talking about sleep disorders, I generally like to give the framework of how to think about this because I find that most people can incorporate it into their own life and thinking in this framework. And that is really thinking about sleep and wake in a continuum of one another. And when doing so, looking at sleep in terms of the duration or total timing of sleep, the quality of sleep, and then the time of day, but also the quality of wakefulness. So many of us, we don't even realize that we're having disrupted or poor quality sleep, but we're suffering and feeling more irritable, non-refreshed when we wake up, and we're going, we slept 8 hours. I don't understand why I'm feeling this way. That is first and foremost a sign that there may be a quality problem, either a quality with your sleep or a quality with your wakefulness, which may be a sign of a sleep disorder. Now, women very frequently get under-recognized in regards to when they make a complaint about any of these things. It is not uncommon that women, when they come to a primary care or a specialist and say, I really feel dissatisfied by my sleep. It's taking me a long time to fall asleep, or I'm waking earlier than I would like. Sometimes they get brought down a path of being diagnosed with mental health conditions, depression, anxiety, and so on and so forth. It's not uncommon that those can co-occur. In fact, many of these mental health conditions have a sleep component to their diagnostic criteria. The other features that are really important is recognizing that sometimes women may be describing things that are different than how men may describe the features that they're seeing. So I'll give a perfect example of that, obstructive sleep apnea. Even when you look at the majority of screeners that we utilize to try to identify who may be at high risk, most of them are slanted towards what would the man look like. Many of them even include male gender as a risk factor. And so very frequently it's looking at, do you have a large neck circumference? Are you overweight? And other features. However, women, depending on their age and their body type, may have other risk factors. For instance, women who are postmenopausal. very frequently they may be a slim fit, have a narrow face like myself, and they can have very severe sleep apnea. That may be the main symptom is feeling dissatisfied with their sleep and waking earlier than desired. And this is all related to a change in hormones. So I do think it's important that when people are looking at the dissatisfaction or concern that they may have a problem with sleep, putting it in one of those 4 buckets can help in leading a very productive conversation with their provider.
Lisa, I'm going to bring you into the conversation to kind of bring this back now to heart health. And what does all of this have to do with heart health? And maybe kind of take us back just a tiny bit and talk about how sleep impacts, what should we know about how sleep impacts our heart health?
Yeah, I think that's really important. And to build on Anne's conversation, women are so unique in a lot of their symptoms and a lot of their presentation. We know that from a heart standpoint, they can present with other symptoms too, but I think it's important to talk about this conversation because especially from a cardiology side, when you go into these appointments, a lot of times the main focus is the heart and we forget that sleep component. So it's so important for women and for all patients to be persistent in, talking about their symptoms, because a lot of times if you've just had a stent and come in, we're going to talk about your medications and are you taking those appropriately, and talk about the importance of cardiac rehab and things that way, where a lot of times sleep is still so new to us that we kind of push it under the table, and we say, oh, are you getting good sleep? Okay, yes. Okay, no. Okay, well, go talk to primary care or go talk to someone else about it. Where I think now from a cardiac standpoint, we're definitely trying to weave that into the common portion of the exam and to ask those questions and to look for those answers because it plays such an important role in the overall heart health. We know that poor sleep can cause increased levels of stress and then in turn raise your risk for those risk factors for heart disease. So can raise your risk for high blood pressure, can put you at, if you don't sleep well at night, you might not have that motivation to go out and exercise during the day. It can cause some problems with mental health, which in turn can affect sleep. So yes, any type of underlying sleep disorder, if you're not sleeping well or you're interrupted from that sleep, can put the heart at risk. So it's definitely important if you are seeing cardiology or primary care to bring up poor sleep, because definitely that can increase your risk. There, in turn, when treating and talking about different sleep disorders, if we can help in treating that, we're going to lessen the stress on the heart. So if it is something like an obstructive sleep apnea where we're not getting enough oxygenated circulation, the heart feels that stress. Mm-hmm. And so in turn, then if we can treat that, we're going to help the heart long term.
If I could just add on to that, Amy, I think that one of the things that as a field we're trying to move away from is thinking about sleep as a medical comorbidity and really part and parcel of the primary management. So when you look at what are the current efforts that are occurring, you can see that the American Academy of Sleep Medicine has created specific credentialing for cardiology groups that integrate sleep. When you look at even the American College of Cardiology, in November of 2020, they put out a statement stating that individuals who have atrial fibrillation, you should not be doing a screening by asking them something like a stop bang, which is a survey to stratify risk. We should be doing polysomnography. Why is that? Because when we do the screener, 68% were positive. When they did the polysomnography, 84% had obstructive sleep apnea. And when we look at that, it's not just an association. It actually is positive. We recognize when you have untreated obstructive sleep apnea, it is going to cause you to develop an abnormal heart rhythm with atrial fibrillation. And although when we think about sleep apnea, we very frequently are thinking about the oxygen component, it really, the main driver of it is actually the sympathetic nervous system. So your fight or flight system becomes dysregulated. It leads to a lot of these downstream effects. And just as Lisa has stated, we now have recognized that it's more than sleep disorder breathing, which is even reflected in the American Heart Association's new Life's Essentials 8, because they're talking about duration. We recognize insufficient duration of sleep is a risk factor for a variety of cardiovascular diseases, but you can even take the inverse. When we look at people who have, say, something like narcolepsy, they are 2 times the risk for adverse cardiovascular outcomes, being higher likelihood for high blood pressure, heart failure, heart attack, as well as stroke. And so this is not a matter of saying we would like to talk about the niceties of you having a better night's sleep. It's about talking about how do we actually optimize your heart, because your heart is functioning when you're awake and when you're asleep.
And I wonder if you could just tell us briefly a little bit about your heart story and how that interacts with sleep.
My event was in 2019, and my cardiologist has never asked about my sleep or my sleep patterns. Just how do I, kind of like generally, how do I feel? What are my, and what are my symptoms? That type of thing, but not anything specifically geared toward my sleep. And my PCP, same thing, not what are your sleep habits? How much do you sleep? That type of thing. I had to tell my PCP that I was struggling with sleep, and he suggested the melatonin. We worked with dosages for a little while, and then I kind of just stopped bringing it up. And he hasn't kind of circled back when I've gone for my physicals or my checkups and said, like, how's that working for you? Or what have you changed? Or what else can we do? None of that.
Madeline, I have to tell you that breaks my heart, because it's just such a common story to hear, right? Of that patients give up on complaining about the things that are most bothersome to them because they feel not heard. And if there's nothing else that people hear from this, I really feel that's the call to action, is that if you're a clinician listening to this or watching this, listen to your patients. Like, that is first and foremost. They know themselves the best. And if you are a patient, continue to advocate for yourself. And if you're not finding the right partnership with the person who's taking care of you, please seek out another opinion. The reality is that in a situation that I'm hearing right now, I'm so discouraged by knowing that this is perpetuating, that when an individual is having a heart event, we've seen this also in the neurology world where people have a stroke, that sleep is not being considered. And the reality is that these are independent risk factors. So the same that it would be medical malpractice for me not to send you home with an aspirin, it also should be considered medical malpractice for me not to consider treating a sleep disorder when a patient is blatantly describing it and when they're at higher risk.
We had a question just come in that I think is really interesting. She says, Susan says, many people experience significant disruptions in sleep during and after COVID. And I would say this is probably true for if you have a lot of flu or other kinds of illness. What do we know about how COVID impacts one's long-term sleep patterns? And are there recommendations for returning to healthy sleep after an illness?
Yeah, this is actually really an evolving area. So when COVID first was kind of present, one of the things that we were seeing, and we even had a term for it, COVID-somnia, right? So people were not sleeping well related to COVID. What we're now identifying is, especially in individuals with long COVID, is that there actually is a higher likelihood for there to be hypersomnolence, so excessive daytime sleepiness. One of the things that I would strongly encourage, recognizing the statements that Lisa just stated, of thinking about the whole person. And again, as a sleep doctor, I can't just think about sleep and not think about all the other things. COVID can affect multiple organ systems. So we would want to make sure that there's not another organ system that is contributing to why you're having unsatisfactory sleep. However, I would also make the recommendation of partnering with a sleep physician or an advanced practitioner to be able to evaluate and really key in on what are the difficulties you're experiencing so that they can personalize that strategy. There isn't necessarily a blanket statement. We always do reflect on those sleep hygiene tips and sleep scheduling. But again, utilizing the strategy of what is the challenge, putting it in one of those 4 buckets of duration, timing of sleep, quality or quality of wakefulness, generally can help you to have a more productive conversation with the team that's taking care of you.
Thank you. I don't see any other questions coming in, so I'll go ahead and thank you all for being here. Are there any final bits of advice or comments you want to make?
I would say that the call to action is that if you are a man or a woman and you're experiencing dissatisfactory sleep, and especially if you have cardiovascular disease already, I think Lisa and I can probably very much agree that this is your call to action to make sure you're being very insistent on having that conversation with your cardiologist or at least your primary care to get you to a better overall wellness.
And I think too, I'll add that it's not just a one size kind of fits all type of thing. So symptoms can be so different. Just make sure you hone in on your symptoms and you're persistent with your symptoms wherever you are seen, whether that is, cardiology, whether that is primary care, whether that is with your sleep doctor. Please just be, persistent about taking the steps to get this looked into, because it's very important.
I appreciate it. Thank you all for being here. I'll tell folks to go to the website for Project Sleep. Of course, go to Women Heart's website to get more information on all of this. And we're going to continue this conversation with blogs and articles and things. So I really appreciate all of you being here and sharing your information with us. I hope you have a wonderful day.